This model, I'd like to highlight what it shows well. Several muscles. One, the abdominals. There's 4 abdominal muscles. The rectus abdominis, and you can see the compartmentalization and the tendinous sections there separating them. We sometimes call that the 6-pack, the 8-pack. 2 strands of muscle tissue, rectus abdominis. Then this is the external oblique. This is number 100 labeled here. And so that's like a side muscle, external oblique. Then over here, they have taken that muscle, the external oblique, and removed a layer. And so we can see that. This is the external oblique, which reveals 101, the internal obliques. And how do you know muscles that are different? Look at the fibers running this direction, then we remove that, they'd be running this direction here. Now we see, you know you're in a different muscle when the fibers, the parallel bundles are in a different direction. So here the internal obliques are running this way, and then you have the transverse abdominis. So I'm going to show you again, the rectus abdominis here, fibers running up and down, external obliques, fibers running in this orientation. 101, internal obliques, after we remove the external, it's underneath, running in this direction. And transverse abdominis, those fibers are running kind of cross-sectionally this direction. All right? Then on the chest too, I just want to note that the pectoralis major here has been removed on this side, and that is the pectoralis minor. So, you know, when there's a major, there's going to be a minor. And there it is. And we'll talk more about this with the respiratory system, how that affects breathing. In the axillary region, the serratus anterior muscles are here. And this particular model just shows those things. And I'll go over the other things. It may not be that clear, but here we mentioned on the face and head, orbicularis oculi. You've got the depressor anguli oris. This is the depressor labii inferioris. These are like your frowning muscles. There's the zygomaticus. There's a major and a minor. Those are your smiling muscles. And then the orbicularis oris. So orbicularis oculi, zygomaticus, major, minor, depressor anguli oris, depressor labii inferioris, orbicularis oris. All right. Other muscles we can see: sternocleidomastoid, trapezius, deltoid, biceps brachii, brachialis, triceps brachii, lateral head, long head. There are better examples of the arm, but I'll label name what I can see here. The brachioradialis. Next to that, remember on this side of the hand are the extensors. Extensors mean they can pull the palm of your hand back. And this first extensor is the extensor carpi radialis. Then the next set goes to the digits, the extensor digitorum, and it's including the digits here of the fingers. And then we have the extensor carpi ulnaris, right? The ulna is on the pinky side, extensor carpi ulnaris. The thumb side is the radial bone, so we have the extensor carpi radialis, all right? The bone, the muscles on the inside of the arm, maybe I can get, you know, I used other models. I think I'm gonna skip, it's just hard to get that in there quite as well. Yeah, I can't get it in the view. All right, other muscles, let's go ahead and name what we can see here. I can see the quadriceps, vastus medialis, rectus femoris, and the vastus lateralis. Inside of the leg, thigh area, adductor longus, pectineus, iliopsoas. The sartorius has been removed, but you can see it here. And the gracilis is there. Lower leg. Use the tibia as your starting point to start with the tibialis anterior, peroneus longus, gastrocnemius, soleus, lost an arm, hamstring muscles. Remember the outside one, biceps femoris, semitendinosus, gluteus maximus. This muscle here is the tensor fasciae lati, or tensor fascia lata, that connects to the iliotibial band, the IT band. Other muscles of the back that we can see: latissimus dorsi, teres major, teres minor, infraspinatus, trapezius. Again, deltoid. We've named the others. That's mainly what we see pretty clearly on this model.